14 types of headaches and their remedies. Headaches vary widely in their causes, intensity, and duration. Whether it's the common tension headache or the rarer ice pick headache, understanding these types can help in managing symptoms effectively. Below is an overview of different headache types, potential causes, and their treatments. Primary versus secondary headaches. Primary headaches are standalone conditions like tension headaches or migraines, not caused by other health issues. Secondary headaches are symptoms of underlying conditions, such as sinus infections or high blood pressure. Common types of primary headaches. 1. Tension headache. Tension headaches are the most frequent type of headache experienced by people worldwide. They often feel like a constant, dull, aching sensation or a tight band wrapped around the head. This discomfort can extend to the neck, shoulders, and scalp, causing sensitivity or tenderness in these areas. Stress, anxiety, dehydration, poor posture, and fatigue are the most common triggers. These headaches usually do not cause nausea, vomiting, or sensitivity to light or sound, which differentiates them from migraines. While occasional tension headaches may last from 30 minutes to a few hours, chronic cases can persist for days or recur frequently, affecting the quality of life. Effective treatments include OTC pain relievers such as ibuprofen, acetaminophen, or aspirin. Chronic tension headaches may require lifestyle adjustments, including stress management, regular exercise, improved posture, and physical therapy. 2. Cluster headache. Cluster headaches are one of the most painful headache types, characterized by severe, piercing, or burning pain. This pain is often localized around one eye or one side of the face. Additional symptoms include redness or watering of the eyes, nasal congestion, facial sweating, and restlessness. These headaches occur in clusters or cyclical patterns, often striking at the same time each day. Each episode can last from 15 minutes to 3 hours and may repeat multiple times a day during the cluster period, which can persist for weeks or months. Cluster headaches are more common in men and are frequently triggered by alcohol, strong smells, or disruptions in sleep patterns. Treatments such as oxygen therapy, sumatriptan injections, and preventive medications like corticosteroids or calcium channel blockers can help manage symptoms and reduce recurrence. 3. Migraines are a complex neurological condition that can cause severe and debilitating headaches. The pain is typically throbbing or pulsating and localized to one side of the head. Associated symptoms often include nausea, vomiting, and extreme sensitivity to light, sound, or smells. A unique aspect of migraines is the aura experienced by some individuals before the headache begins. Auras may involve visual disturbances such as flashing lights, zigzag lines, or blind spots, as well as tingling sensations or difficulty speaking. Triggers for migraines vary but commonly include hormonal changes, certain foods like aged cheese or chocolate, caffeine, stress, weather changes, and sleep disturbances. Migraines can last from 4 to 72 hours and significantly impact daily activities. Treatment includes abortive medications like triptans or ergotamine for acute attacks and preventive options such as beta blockers, CGRP inhibitors, and lifestyle modifications for frequent episodes. 4. Hemicrania continua. Hemicrania continua is a rare headache disorder characterized by continuous pain on one side of the head. The pain is moderate but can intensify periodically, often accompanied by symptoms like eye redness, nasal congestion, and sensitivity to light and sound. This headache type is unique because it responds completely to indomethacin and NSAID, which is both diagnostic and therapeutic. Patients typically require ongoing treatment with the lowest effective dose to minimize side effects. 5. Ice pick headache. Ice pick headaches, or primary stabbing headaches, are sharp, stabbing pains that strike without warning. These headaches are brief, lasting only a few seconds, but their intensity can be startling and distressing. The pain often occurs in the temples or around the eyes and may repeat several times a day. Ice pick headaches are idiopathic but can occur more frequently in individuals with migraines or cluster headaches. Preventive treatments, such as indomethacin or gabapentin, may be effective in reducing their frequency. 6. Thunderclap headache. Thunderclap headaches are sudden, severe headaches that peak in intensity within a minute. Often described as the worst headache of one's life, they may indicate a serious underlying condition such as a ruptured aneurysm, stroke, or reversible cerebral vasoconstriction syndrome. Immediate medical evaluation is crucial to identify or rule out life-threatening causes. If no secondary cause is found, the headache is treated as a primary thunderclap headache with medications like NSAIDs, beta blockers, or triptans. Common types of secondary headaches. 7. Allergy or sinus headache. Allergy or sinus headaches occur due to inflammation or congestion in the sinuses, often triggered by seasonal allergies or infections. The pain is localized in the forehead, cheeks, or around the eyes and is accompanied by nasal congestion, a runny nose, or fever. These headaches are sometimes misdiagnosed as migraines because of overlapping symptoms. Treatment involves managing the underlying cause, such as with decongestants, antihistamines, nasal steroid sprays, or antibiotics in the case of a bacterial infection. 8. Hormone headache. Hormone headaches are linked to fluctuations in estrogen levels, commonly occurring during menstruation, pregnancy, menopause, or with the use of hormonal contraceptives. They often resemble migraines, with throbbing pain, nausea, and sensitivity to light or sound. Management includes OTC medications like naproxen or prescription drugs like frovatriptan. Stress reduction, exercise, and dietary changes can also help reduce the frequency and severity of hormone-related headaches. 9. Caffeine headache. Caffeine headaches result from abrupt changes in caffeine consumption. Withdrawal can cause a dull, persistent headache due to changes in blood flow to the brain. Conversely, excessive caffeine can also trigger headaches. Gradual reduction of caffeine intake and maintaining a consistent consumption level can prevent these headaches. 10. Exertion headache. Exertion headaches occur during or after intense physical activity, such as running, weightlifting, or sexual activity. These headaches are characterized by throbbing pain on both sides of the head and are typically short-lived. Frequent occurrences may indicate an underlying condition, so medical evaluation is advised for persistent or severe cases. 11. Hypertension headache. Hypertension headaches occur when blood pressure rises to dangerously high levels, often exceeding 180/120. These headaches are usually pulsating and affect both sides of the head, accompanied by symptoms like chest pain, shortness of breath, or visual changes. This type of headache requires immediate medical intervention to lower blood pressure and prevent complications. 12. Medication overuse headache. Medication overuse headaches, also known as rebound headaches, result from frequent or excessive use of pain relief medications. Over time, these headaches become more frequent and severe, resembling tension or migraine headaches. Treatment involves gradually discontinuing the overused medication and exploring preventive strategies with a healthcare provider. 13. Post-traumatic headache. Post-traumatic headaches develop after a head injury and can persist for weeks or months. They often mimic tension headaches or migraines and may worsen with stress or fatigue. Treatment includes managing symptoms with pain relievers, stress reduction, and physical therapy when necessary. 14. Spinal headache. Spinal headaches are caused by decreased cerebrospinal fluid pressure, often following a lumbar puncture or epidural. These headaches worsen when upright and improve when lying down. Associated symptoms may include nausea, dizziness, and neck stiffness. Severe cases may require an epidural blood patch to seal the cerebrospinal fluid leak and alleviate symptoms. When to seek immediate medical attention, headaches accompanied by the following symptoms may indicate a serious condition: stiff neck or rash, severe or worst ever headache, vomiting, confusion, or slurred speech, fever above 100.4 degrees Fahrenheit 38 degrees Celsius, to paralysis, vision loss, or other neurological symptoms. Management and prevention: identifying triggers, maintaining a consistent sleep schedule, staying hydrated, and avoiding known triggers like certain foods or stressors can reduce headache frequency. For chronic cases, consult a healthcare provider for tailored treatment and prevention strategies. Headaches are often manageable, but understanding the type you're dealing with is key to effective treatment. When should you seek help for a headache? In many cases, episodic headaches are short-lived and typically subside within 48 hours. However, there are instances when professional medical intervention is necessary. If you find that your headache persists for more than 2 days or progressively worsens in intensity, it's a sign to consult a healthcare provider. Similarly, if you experience headaches on more than 15 days a month over the course of 3 months, you might be dealing with a chronic headache condition. Even if over-the-counter, OTC, medications provide some relief, consulting with a doctor is important for a thorough diagnosis and effective management. Headaches are not always isolated discomforts. They can be symptoms of underlying health concerns that require more attention than home remedies or OTC medications can offer. Conditions such as high blood pressure, infections, or neurological issues may manifest through persistent or severe headaches. Therefore, timely medical consultation is crucial to address these potential risks. If you're unsure where to start, many tools and resources, such as primary care locator services, can help you connect with a healthcare provider. How to identify your headache type? Proper identification of the type of headache you're experiencing is essential for effective treatment. Typically, the diagnostic process starts with a detailed review of your medical history and a physical examination. Keeping a headache journal in the weeks leading up to your doctor's appointment can provide invaluable insights. In this journal, note the following details for each headache episode: the duration. How long does each headache last? Intensity. How severe is the pain? On a scale from mild to unbearable? A location. Is the pain localized to a specific part of your head? Triggers. Are there identifiable factors that seem to bring on the headache? Since headaches have many subtypes, a healthcare provider may employ various diagnostic methods to determine whether you're dealing with a primary or secondary headache. Understanding this distinction is critical for choosing the right treatment path. In some cases, your primary care doctor might refer you to a specialist, such as a neurologist, for further evaluation. To identify the underlying cause, diagnostic tests may include imaging, MRI or CT scans, blood tests, or a lumbar puncture to assess cerebrospinal fluid. These tests are often reserved for cases where symptoms suggest an underlying condition, such as a neurological issue or an infection. Treatment and management of headaches. Each headache type requires tailored treatments. Below are common approaches based on the headache category. Primary headache treatments: tension headache, OTC pain relievers, aspirin, ibuprofen, acetaminophen usually suffice. For chronic cases, doctors may prescribe medications like indomethacin or ketorolac. As cluster headache, treatments may include oxygen therapy, sumatriptan, or lidocaine. Preventive measures like corticosteroids, melatonin, or calcium channel blockers can reduce recurrence. In migraine, triptans, sumatriptan, rizatriptan effectively address pain. Preventive medications, such as propranolol, topiramate, or CGRP antagonists, may be recommended for frequent or debilitating episodes. A hemicrania continua. Indomethacin is typically the go-to treatment, though doctors carefully manage dosages to minimize side effects. A ice pick headache. These brief, sharp pains are managed preventively with indomethacin, gabapentin, or melatonin. Thunderclap headache. Immediate evaluation is crucial to rule out severe underlying conditions. If determined to be primary, treatment may include NSAIDs, beta blockers, or triptans. Secondary headache treatments: allergy or sinus headache. Decongestants, antihistamines, and nasal sprays relieve symptoms. If caused by an infection, antibiotics may be necessary. A hormone headache. Medications like naproxen or frovatriptan help manage pain. Lifestyle adjustments, such as stress management and regular exercise, can also be beneficial. A caffeine headache. Gradually reducing caffeine intake or maintaining a consistent consumption level can prevent these headaches. An exertion headache. OTC pain relievers often provide relief. Frequent occurrences may warrant medical evaluation. Hypertension headache. Resolving high blood pressure typically alleviates these headaches. Immediate medical attention is required for dangerously high readings. A medication overuse headache. Gradually discontinuing the overused medication under medical guidance is the only solution. Preventive medications may help avoid recurrence. Post-traumatic headache, commonly treated with triptans, beta blockers, or amitriptyline. A spinal headache. Rest, hydration, and avoiding upright positions aid recovery. For severe cases, an epidural blood patch may stop cerebrospinal fluid leakage. Can headaches be prevented? Preventive strategies vary depending on the headache type. Lifestyle modifications often play a significant role in reducing frequency and severity. Regular, adequate sleep, balanced meals and hydration, consistent exercise, effective stress management. Preventive medications, such as CGRP antagonists, are available for conditions like migraines and cluster headaches. What's the outlook for headaches? The prognosis depends on the headache type. Primary headaches. While not life-threatening, they can disrupt daily life. Proper diagnosis and treatment usually offer effective relief. Secondary headaches. The outcome hinges on addressing the root cause. Some are manageable with minor changes, while others may require urgent intervention. For recurring or severe headaches, seeking an accurate diagnosis is the first step toward better management and improved quality of life.